Welcome to another one of our sessions. My name is Zoe Clark. I'm Senior Self-Management Programme Officer here at NASS, and I'm joined today by Dr Arul James, who is a consultant in pain medicine. Hi Arul, how are you?
I'm fine, thank you, Zoe. Thanks for the opportunity.
Yeah, thank you for joining us. I'm just checking, making sure we are all connected. Yeah, perfect. Lovely. So everyone who's joining us live, please do pop any questions in the comments as we're going through. Arul will be sharing a presentation with us with some pain management tips for people living with axial SpA. And then we're going to have a Q&A as well, so there'll be plenty of time for questions. So please do add those there. We can't answer really specific clinical questions, but more general questions around pain management we're able to, and can always sort of recommend the right healthcare professional to speak to for the more specific ones. So yeah, and as always, our video will stay on the Facebook page afterwards and also upload to our YouTube channel. So if you're not able to join for the full session, please do come back and catch up afterwards. And we can also keep an eye on the questions as they go through. So before we get started, Arul, do you want to tell us a little bit about yourself?
Yep, I'm a chronic pain consultant and anaesthetist. I work in the NHS in West Midlands, George Eliot Hospital, and I live in Birmingham, so in the Midlands. And I've been a consultant for the last 2 years, and I've been looking after people with chronic pain, and it could be generalized pain, back pain, headaches, and we do medication management or injection treatments, interventions. So first-hand experience of how the management works.
That's brilliant. We so appreciate your time this evening. And I know you'll mention your book in the session as well. So we'll put the link to your book in the pinned comment as well. So for anyone who's interested in that, we'll pop that there, as well as any links that we mentioned during the session. So wonderful. Arul, are you happy if I pass over to you and then we come back to some questions afterwards?
Let me share my screen.
Lovely, thank you.
Can you see my screen all right?
Yep, that's great. Thank you.
Yep. So as Zoe mentioned, I recently published a book, Empowering Pain Management. And that's me, consultant chronic pain medicine and anesthetics, as mentioned before. So want to talk briefly about why I wrote the book and what's this book regarding, and how it can be useful for people with axial SpA. So my motivation to write this book was that in my clinic, when I see patients, they would have waited a long time before seeing a pain consultant or a pain specialist. And that's not just with any particular hospital or setting, it's a general occurrence in the medical field. And I also wanted to increase the awareness of pain self-management options to patients and to the friends and family. And as I mentioned before, there are pain medications and pain interventions which we offer for patients, but none of the treatments are going to be 100% effective. What I normally say is each treatment, each medicine can be effective 40 to 50%. So the pain is going to be improved by 40 to 50%, but what's going to happen for the remainder of the 40 to 50%? So that's where the pain self-management options come in, which I mentioned in the book. And what is empowering pain management? Empowering pain management, I wanted to be a guide for people to understand chronic pain and to understand what are the different options available to manage chronic pain. And that's what I mentioned in the book. I want people to regain control of their life and to navigate relationship with loved ones when they've got chronic pain, because pain doesn't affect just an individual. It's not just a symptom. It's going to affect a person's whole life, the friends, the family, and what they do. And who's being empowered, not just in the book, in general. I'm very passionate about empowering pain management, and who do I want to be empowered? It's mainly the people with chronic pain, but also their friends and family, because I would like to improve or increase the awareness of chronic pain and the understanding of chronic pain, not just among the patients, but also to the friends and family. And some of the doctors, primary care and secondary care specialists as well, as to what people can do on their own as self-management options. And why is this important? Because we need to avoid missed opportunities to try effective pain management options. And in my book, I've divided them into 5 sections and 5 steps. Step 1 is starting with the basics, brief chapters on the science of pain, personalized pain management plan, and brief overview of the alternative and complementary therapies. So each individual is unique. What works for one person wouldn't work for another person. And that's why we need to know what are the different treatment options which are available, in addition to the medications, in addition to the interventions which we offer in the hospital. And step 2 is finding your goals. So with pain, we call it chronic pain when the pain's been there for more than 3 months, or when the pain's persisting even after the healing process has been completed. And when we are in chronic pain, we need to understand the mechanism or the basics of pain, and then we need to find the goals which should be achievable and realistic. And that's what I've mentioned and detailed in my book. And step 3 is to understand and explore the different treatment approaches for chronic pain, which includes mind-body techniques and meditation, yoga, tai chi, nutrition, TENS, CBT, and specialized care for chronic pain. That's where the secondary care or the specialist doctors in the hospitals come in as well. So there are different treatment approaches. And as I mentioned in the beginning, each person's taste would be different. Someone might find a lot of benefit from yoga or tai chi, but someone might find a lot of benefit from a TENS treatment, or some people may not find benefit from any of these approaches, and it might just be a medication and interventions. But it's good to have all the options available for each person. And the next step is experimenting with coping strategies, because with chronic pain, we all know there's going to be flares and exacerbations. It's part and parcel of the chronic pain symptom, and with Axial SpA as well, the pain's going to be better on some days, it's going to be worse on some days, but how are we going to manage it? It's understanding that it's going to be having ups and downs. And chapter 14 talks about sleep management, because sleep and pain are interrelated. If you're not slept properly, if you got poor sleep, it's going to increase the sensitivity, or it's going to wind the nervous system to feel more pain. Same with the mood and chronic pain. If you're having if you're feeling anxious, or if you're having low mood, it's going to wind the system up to feel more pain or become more sensitive to chronic pain. And finding effective activity pacing. So if you're not able to do work for long period of time, how can we divide it into smaller pieces so that we can, at the end of the day, achieve what we want to achieve, but in smaller pieces, rather than trying to do them in one single phase. And I also mentioned about somatic exercises to ease chronic pain. And these treatments doesn't need to be standalone, but they can be together with what consultants and doctors are offering from the hospital. So it wanted to complement the medications and the treatments we offer. And step 5 is building a support system. As I mentioned, pain is not going to affect just the individual. So what I ideally want is people to have a good support system. And the chapters about how to build a support system and how to overcome the stigma of chronic pain, managing chronic pain in the workplace, advocacy, and how relationships can be helped when someone's in chronic pain, and how to support your loved ones with chronic pain. So that last chapter is for friends and family to understand better how an individual's life is affected when they've got chronic pain. And what next for me? I want this resource made available to everyone as much as possible. And I'm trying, in the book, there's not much videos or photographs. I'm trying to build some videos which I can share freely over the internet. And the last step is to try to get an audiobook released, so that people who may not find reading that easy, or who want to listen to audiobooks, or who prefer listening to audiobooks, might benefit from the strategies I mentioned in the book. So that's everything, and it's been mainly about my book. And again, I can take questions if people have any, or Zoe, if you have anything else to discuss about.
That's wonderful. Thank you so much.
Stop sharing.
Wonderful. I'm just going to check that I've got our videos pinned as well so everyone can see us. Yeah, perfect. That was great. That was a really good overview. And I can say for anyone who's not seen the book, it really is an extensive guide to all of those topics. So it's really, really good. And I love the different stages that you lead people through as well. Yeah, and any sort of future things you're releasing would be great for us to share with the community too. Sounds really good things in the pipeline as well. So we have had some questions coming in. And I'd had some sort of prepared already. And I just wanted to ask again, sort of if people can take medication alongside using the pain sort of management techniques that you've described.
Yeah, absolutely. So pain medications, if they are helping you to some extent, which is very good, but how can we improve the effectiveness? So what we want is better quality of life, better pain management. So the medications, we normally titrate it. So your doctor would be titrating the medication. But if you reach the stage where you've tried all the medications, you've reached the maximum dose, increasing more might cause side effects. So that's where these techniques come in to help see which additional technique you can add on to the treatments you're already having. And with medications as well, in my practice, there are a few medications which you try. Some people get great benefit, which is really good, but some, unfortunately, don't see much benefit or they get side effects. What are we going to offer to those people? So it's just to add in every person's repertoire what we can do to help manage pain better.
Yeah, and I like how you mentioned there are lots of different options, but different things will work for different people as well. We quite often say that when we're talking about flares in particular with Axial SpA. We had a question from Zainab, who's joined from Mauritius, live watching us, and they asked, could you expand more on the mind-body techniques that you mentioned?
Yep. So mind-body techniques, there are different varieties in the internet or in the online forum. So CBT, cognitive behavioral therapy, yoga or Tai Chi. So they are. So if you take CBT, what it says is trying to calm the mind or ease, trying not to make pain the focus of our life. So if you do that, then it's going to be a vicious cycle. So you're in a lot of pain, we feel very anxious, and we don't get much sleep. We're not going to go out with friends and families, and we're going to say it's all because of pain. It's all because of what's happening to my body. But then in CBT, there's normally we have a CBT therapist who can help you go through the sessions, go through how you're feeling and how we can decrease your emotional aspects when you're suffering from chronic pain. And with yoga or mindful exercises or somatic exercises, it's trying to do gentle movements, gentle poses, which you can stretch the muscles or increase the range of movements. Say, for example, if someone's got shoulder pain, we may not be able to fully abduct your shoulders. But what's the idea behind all these exercises is not to say it's going to help you or give you back the full range of motion. It's to gently exercise or stretch the muscles as much as you can, so that you're not losing any more function or strengthening the muscles. Again, we've got physiotherapists who can help with these exercises in particular. And the talk I'm doing today and the book, it's just an overview of that's available, and you can get the help of a CBT specialist or a physiotherapist or someone who can do yoga or Pilates, especially for people with chronic pain, because the yoga poses or other somatic exercises, it needs to be modified for people with chronic pain. We might need to use blocks or bands or chairs instead of trying to lie on the floor, which may not be possible for someone with chronic pain. And that's the reason I've given everything as an overview in this presentation and in my book.
That's great. Thank you so much. And also for Zainab as well, because you mentioned not having many specialists available. We've got some taster sessions on our YouTube channel on yoga, Pilates, and somatics as well, including some seated exercises. That might be a good way to try them out and see if they help for you. Wonderful. And I've got a question from Stacey, who emailed me. She has axial SpA and she's feeling a bit overwhelmed in terms of like getting started on sort of adding in other things. Is there an area where you can recommend sort of how to get started and not feel so overwhelmed?
So pain, it affects each person differently. So and when we are feeling overwhelmed, it's my suggestion would be there is light at the end of the tunnel. There are treatments out there which might be benefiting you. So I hope that pain is not going to be as bad as it is for people who are watching the program, but it would improve either with the medical treatments, interventions, or the holistic approaches which I mentioned in the book. And it's as simple as taking the first step. So in my book, or even if you go to Amazon, just go through the contents in my book. If you just pick and choose whichever strategy you would like with a personal preference, do something which you like. That's what's going to help you the most, because your mind and body is already inclined to do something, and you can try to find out how much it's benefiting your pain. And then once your pain is a little bit better, then you can explore the other options.
That's brilliant. Thank you. And very sort of reassuring as well. Wonderful. And I wanted to ask as well, if someone's sort of struggling to manage their pain, is there a particular healthcare professional they can ask to be referred to for that sort of personalised advice as well?
So within the UK, the patients with pain, their steps or their pathway is going to be over-the-counter medications to begin with, and then general practitioners, they're going to help manage the pain. Then in the primary care, we have MSK therapist or first contact physiotherapist who might be able to advise about exercises, activity pacing, and lifestyle management. When people have tried all these and the pain's still there, it's not being managed properly, or if the pain is not getting under control, that's when a referral to a pain consultant might help. And usually, like pain consultant where I am, we have a multidisciplinary team. So in my team, it's a pain consultant. We've got clinical nurse specialists, so nurses who have been specialized in doing chronic pain management for, especially in my place, even before I was born, she was a nurse. So a lot of experience. And we got physiotherapists who specialize in chronic pain management, and physical health psychologists who help with people with chronic pain. So when you are referred to a secondary care center, we have all these people to help manage your pain. So you'll be seen by a consultant and then taken through all the treatment options which are available, and then referred to the other allied health specialist if required or as required, in addition to the medicines and interventions.
Oh, fantastic. It's great to know there are so many different healthcare professionals available to support as well. So yeah, we definitely recommend speaking to your GP if you feel that would be beneficial. Okay, wonderful. Well, we've covered all the questions so far. So anybody watching, if you've got any questions, please do pop those in the comments there. And yeah, I guess the next thing would be to say that we've got the link to the book in the video comments as well. So if you'd like to learn more, please do head there. And was there anything else you wanted to add, Arul? It's been a really great overview. It's been fantastic.
Just anecdotes. So one, reviews for the book. Good feedback from people who have reviewed the book so far. They found it beneficial. So as you said, or as we mentioned, there's so many things, so many strategies which are available to help someone manage the pain. And also to say that some of the patients, when they come to see me in the pain clinic, they said they didn't even realize that there's a pain specialist or there's a pain team in the hospitals. So I hope all these, what we're doing, the videos would help people understand there is a separate specialty, pain specialty, pain management medicine in the hospitals to help manage pain. And we work along with the surgeons, say, for example, shoulder surgeons or foot and ankle surgeons, and general surgeons, and also rheumatology consultants or endocrinology consultants. So people are being managed by their own specialists. And when the pain is still there, even after surgery, and the surgeons refer patients to us, and same again from general practitioners. We see referrals when people have tried medications, conservative treatments, and pain still not managed properly, or there's still scope to explore other interventions. That's when we get the referrals. So I hope more people would be getting awareness about the pain management specialty, which we can avail to help manage the pain better.
Absolutely. It's really great to raise awareness of that. And I liked in your introduction as well, you said, part of this as well as raising awareness of chronic pain for the public and understanding for friends and family, because that's such a key part of the support network as well.
And advocacy is very important, not just from a patient perspective. So when people are going to a pain clinic, I always encourage bringing along a family or friends, because there's a lot of information which might be shared. So if there's someone else who can come along, support you in your pain clinic appointments, I would encourage that. And advocacy, not just in the hospital, but also in the workplace. So if someone's got chronic pain, what can be done to modify, to help keep you in the work, and advocacy in general. People in the positions where they can help increase the awareness of pain as a specialty, or people who can help improve how the pain management specialists work in the hospitals. Again, it's all only when you ask, what can be offered or what can help everyone.
Absolutely. And I imagine speaking to the professionals gives you that confidence in kind of knowing what you can ask for in terms of support. And because it can be difficult, especially as a lot of pain's invisible as well. So it can be really difficult to have those conversations. Yeah. That's fantastic. Thank you so much. We don't have any other questions coming in at the moment, but what I'll do is I'll keep an eye out over the next week or so. And if you're happy, I can pass any of those questions on to you as well. And we can reply in the comments. Wonderful. That's been brilliant. So yeah, I'll just let everybody know about the next session that we're running. So our next session is going to be on Wednesday, the 15th of November at 1 p.m. And I'll be talking with Dr. Elena Nikiforu about diet and inflammatory arthritis. So that's going to be a popular one, I think, as well. These are both very popular topics. Wonderful. And as always, the video for this session will stay on our Facebook page. So if you've joined partway through, you can come back once we finish the live stream and catch up. And also it'll be on our YouTube channel and our My AS My Life page on our website as well. And again, I've popped the link to your book and also tagged your Facebook page in the comments as well. So do head on over there as well to keep an eye out on what's next from Dr. Arul. So wonderful. Thank you so much again. And thank you everyone for joining us live, and hopefully see you next time. Take care.
Take care, everyone.